Ladies, I need you to sit down for this one, because what I'm about to tell you will fundamentally change how you think about sharing information with your doctor, your hospital, your pharmacy, anyone in the healthcare system. On June 18th, 2025, a single court ruling stripped away privacy protections for your most intimate medical information. Information that was supposed to be protected by a $500 million federal regulation just became fair game for anyone who wants to investigate, prosecute, or punish you for your reproductive healthcare decisions. I'm talking about your actual medical records, the notes your doctor writes after your appointment, your lab results, your prescription history, your hospital discharge summaries. All of it, now vulnerable in ways it wasn't just months ago. We're going to dive deep into what happened, why it matters, and what it means for every woman who will ever need reproductive health care in America. If you're a woman of reproductive age, whether you're 15 or 45, whether you're trying to get pregnant, dealing with infertility, managing a high-risk pregnancy, recovering from pregnancy loss, or navigating any aspect of reproductive health, this affects your medical privacy in ways that should terrify and motivate you. Because your medical records aren't just data points. They're evidence, and in today's legal landscape, that evidence can be used against you in ways the lawmakers who created HIPAA never imagined. Your medical records are more vulnerable than you know. Let me start with a question that might make you uncomfortable. Have you ever assumed that what you tell your doctor stays between you and your doctor? Most of us operate under that assumption. We walk into medical appointments believing in something called medical confidentiality, the idea that our healthcare providers are bound by both ethics and law to protect our private health information. And for reproductive health, that protection was supposed to get stronger, not weaker. But on June 18th, 2025, it became dramatically weaker. The scope of medical information now at risk. Let's talk about what reproductive health data actually means in your medical records, because this goes far beyond what most people realize. When you visit your doctor for any reason, a routine physical, a sick visit, an emergency, your reproductive health information gets documented. Your menstrual history, your contraceptive use, your pregnancy history, including any losses or terminations, your sexual health, your fertility concerns. This information doesn't stay in a separate reproductive health file. It's woven throughout your entire medical record. It's in your medication lists when you're prescribed birth control or hormone therapy. It's in your surgical histories if you've had any gynecological procedures. It's in your family planning discussions, your mental health notes, if you've dealt with postpartum depression, your emergency room visits. Your pharmacy records show every prescription you've filled: birth control, emergency contraception, fertility medications, prenatal vitamins, medications to manage pregnancy complications or losses. Your insurance claims tell a story too. Every appointment with a gynecologist, every ultrasound, every lab test related to pregnancy or reproductive health, every procedure or treatment you've received. The integration problem. Here's what makes this particularly insidious. Reproductive health information can't be separated from your overall health records because reproduction affects every system in your body. Your cardiovascular health during pregnancy, your mental health during fertility struggles, your bone density after menopause, your diabetes management during pregnancy, your medication interactions with hormonal contraceptives. When a doctor treats you for seemingly unrelated conditions, they need your complete reproductive health history to provide safe, effective care. That medication needs to be prescribed differently if you're pregnant. That depression treatment needs to account for postpartum hormonal changes. That blood pressure medication can't be certain types if you're trying to conceive. So when we talk about reproductive health data privacy, we're not talking about a small, discrete set of information. We're talking about information that touches virtually every aspect of your medical care and creates a comprehensive picture of your reproductive life. The documentation dilemma. Every healthcare interaction creates documentation, and that documentation is now more vulnerable than it was a year ago. When you tell your doctor you're trying to get pregnant, that goes in your chart. When you discuss irregular periods, that's documented. When you ask about fertility options, that conversation becomes part of your permanent medical record. When you have a miscarriage, every aspect of that experience, the emotional trauma, the physical recovery, the medical management, all of it gets documented in detail. When you choose to terminate a pregnancy, everything about that decision and care becomes part of your medical record. The counseling you received, the procedure details, the follow-up care, any complications. And here's the crucial point. Your doctors aren't trying to create vulnerabilities for you. They're doing their jobs. They're documenting care so that other providers can understand your health history and provide appropriate treatment. But that documentation is now less protected than it was supposed to be. The HIPAA Reproductive Health Rule, a $500 million promise. Let me take you back to what was supposed to protect you. In 2024, after the Supreme Court's Dobbs decision changed the legal landscape for reproductive rights, the Department of Health and Human Services recognized that women's medical information was at risk. They created the HIPAA Privacy Rule to support reproductive healthcare privacy. This wasn't a small regulatory tweak. This was a comprehensive overhaul of how reproductive health information could be used and shared. The government estimated it would cost healthcare organizations over $582 million annually to comply with this rule. Think about that number. More than $500 million every year just to protect reproductive health information. That tells you how extensive and comprehensive these protections were supposed to be. What the rule would have protected. This rule would have created a fortress around your reproductive health information in medical records. Here's how it would have worked. First, anyone requesting your reproductive health information from your healthcare providers, law enforcement, government agencies, even some civil parties, would have had to provide a signed attestation explaining exactly why they needed it and swearing that they wouldn't use it to investigate or prosecute you for lawful reproductive health care. Think of it like requiring someone to sign a sworn statement before they could access your diary. They'd have to explain their purpose and promise not to use your private information to harm you. Second, healthcare providers would have been prohibited from sharing your information if they knew or suspected it would be used to investigate, prosecute, or punish you for reproductive health care that was legal where and when you received it. Third, the rule would have covered not just you as the patient, but anyone who helped you access care. Your partner, your friend who drove you to appointments, your mother who supported you through a difficult pregnancy, healthcare providers who treated you. Fourth, your healthcare providers would have had to update their privacy notices to specifically explain how they protect reproductive health information, giving you clear information about your rights. The comprehensive scope of lost protection, the rule defined reproductive health care very broadly, recognizing that reproductive health touches many aspects of medical care. Contraception services. Not just prescribing birth control, but counseling about options, managing side effects, providing emergency contraception. Fertility services, diagnosis and treatment of infertility, fertility preservation, assisted reproductive technologies like IVF. Pregnancy-related care, prenatal care, delivery, postpartum care, management of pregnancy complications, treatment of pregnancy loss. Abortion care, including medication abortion, surgical procedures, and follow-up care. Gender-affirming care related to reproductive health, hormone therapy, fertility preservation before transition, reproductive counseling. Menstrual and sexual health care, diagnosis and treatment of menstrual disorders, sexual dysfunction, sexually transmitted infections. Even some preventive care was covered. Mammograms, cervical cancer screening, counseling about reproductive health risks. The implementation that never fully materialized. Healthcare organizations across the country spent months and millions of dollars preparing to implement these protections. Hospitals rewrote their policies. Health systems trained their staff. Electronic health record systems were updated to flag reproductive health information for special handling. Legal departments at major health systems developed new protocols for responding to requests for reproductive health information. Training programs were created to help staff identify when these protections should apply. Insurance companies revised their procedures for handling claims related to reproductive health care. Pharmacy systems were updated to protect information about reproductive health medications. The compliance deadline was December 23, 2024. Many organizations met it. They implemented new safeguards, updated their systems, trained their workforce. And then, 6 months later, a single federal judge made all of that preparation worthless. The June 2025 catastrophe Judge Matthew Kaczmarek of the Northern District of Texas didn't just overturn the rule, he vacated it. That's a legal term that means the rule is treated as if it never existed. He found that the Department of Health and Human Services had exceeded its authority in 3 ways. The rule improperly interfered with state child abuse reporting laws. It illegally redefined key terms in federal law, and it violated the Major Questions Doctrine, the principle that federal agencies can't make major policy decisions without explicit congressional authorization. The decision had immediate nationwide effect. Every healthcare organization that had implemented these protections had to remove them. Every policy that had been written to protect reproductive health information had to be rewritten. Every training program that taught staff to handle reproductive health information with special care became obsolete. It was regulatory whiplash on a massive scale, and it left your medical information more vulnerable than many healthcare providers even realized. The current vulnerability landscape. So where does this leave your medical information today? In a position that's more precarious than it's been in decades. Your reproductive health information in medical records is now governed only by the basic HIPAA Privacy Rule, the same protections that apply to any other medical information. And here's the problem. Those basic protections have exceptions that can be exploited. HIPAA allows healthcare providers to disclose your medical information without your consent for law enforcement purposes, court proceedings, health oversight activities, and other specific situations. What the vacated rule would have done is create special restrictions for reproductive health information in those situations. Now those special restrictions are gone. Law enforcement access to your medical records. Let's talk about law enforcement access, because this is where the rubber meets the road for your privacy. Under current HIPAA rules, healthcare providers can disclose your medical information to law enforcement in several situations, in response to a court order, subpoena, or administrative request, to identify or locate a suspect or fugitive, to report gunshot wounds or other injuries that may have resulted from criminal activity, to avert a serious threat to public health or safety. Before June 2025, the reproductive health rule would have added layers of protection to these disclosures when they involved reproductive health information. Law enforcement would have had to provide attestations. Healthcare providers would have had to assess whether the reproductive care was lawful before disclosing information. Now those extra protections are gone. If law enforcement wants your reproductive health information and they can meet the basic HIPAA requirements for disclosure, healthcare providers can share it.